Hi, my name is Andrea, and I will be informing you on hepatitis. Hepatitis is classified as an inflammation of the liver. It is caused by viral infection in most cases, but there are other causes. Other causes include toxins, drugs, alcohol, and autoimmune disease. Hepatitis A is the type that is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis A. Hepatitis B is transmitted through contact with infectious body fluids such as blood, vaginal secretions, or semen containing the hepatitis B virus. Injection drug use, having sex with an infected partner, also increases a person's risk of acquiring hepatitis B. Hepatitis C is transmitted through direct contact with infected body fluids, usually through injection drug use and sexual contact. Hepatitis D is usually contracted through direct contact with infected blood and occurs in conjunction with hepatitis B. Hepatitis E is a waterborne disease that usually occurs in areas with poor sanitation and results from fecal ingestion through contaminated water. According to the Centers for Disease Control and Prevention, approximately 4.4 million Americans are currently living with chronic hepatitis B and C. Between 2012 and 2016, the number of hepatitis A viruses reported to CDC fluctuated because large outbreaks occurred. The first increase between 2012 and 2013 was due to large multi-state outbreak associated with pomegranate aerosols imported from Turkey. Between 2015 and 2016, the reported cases again increased by 44.4%. Each outbreak was linked to imported foods. Since the 1990s, with the widespread introduction of hepatitis B vaccination, there has been no consistent trend in acute hepatitis B virus cases since 2012. Reported cases of acute hepatitis C virus infection increased from 2010 through 2016. Hepatitis C virus infection increased 20.2% from 2012 to 2013, increased 2.6% in 2014, 11% in 2015, and 21.8% in 2016. The increase in acute hepatitis C virus case report reflects new infections associated with rising rates of injection drug use. Because there are vaccinations available for hepatitis A and B, we see a wide decrease in outbreaks and deaths. However, we see an increase with hepatitis C due to greater injection drug use and body fluid being transmitted sexually. On the left, this graph shows a decrease in the hepatitis A virus. On the right, we see a decrease in the hepatitis A virus, along with a decrease in the hepatitis B virus. However, we see an increase in the hepatitis C virus due to injection drug use sharing. Chronic hepatitis B or C can often lead to more serious health problems. Because the virus affects the liver, people with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, and liver cancer. When your liver stops functioning normally, liver failure can occur. Liver failure includes bleeding disorders, buildup of fluid in your abdomen, increased blood pressure in portal veins, kidney failure, hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities, liver cancer, and even death. People with chronic hepatitis B and C are also encouraged to avoid alcohol because it can accelerate liver disease and failure. For symptoms, if you have infectious forms of hepatitis that are chronic, like hepatitis B or C, you may not have symptoms in the beginning. Symptoms may not occur until the damage affects liver function. Signs and symptoms of acute hepatitis include fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, yellow skin and eyes known as jaundice. For treatment, hepatitis A usually doesn't require treatment because it's a short-term illness. The hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between ages 12 and 18. The hepatitis vaccination is also available for adults and can be combined with the hepatitis B vaccine. Acute hepatitis B doesn't require specific treatment. Chronic hepatitis B is treated with antiviral medications. Hepatitis B can also be prevented with vaccination. It occurs in a series of 3 vaccines. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. People who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. Liver transplant may also be necessary if a person develops cirrhosis, and there is no vaccination currently available for hepatitis C. No antiviral medications also exist for the treatment of hepatitis D at this time. However, hepatitis D can be prevented by getting the vaccination for hepatitis B, since infection with hepatitis B is necessary for hepatitis D to develop. Currently, no specific medical therapies are available to treat hepatitis E. This acute infection typically resolves on its own. Practicing good hygiene is one key way to avoid contracting hepatitis A and E. If you're traveling to a developing country, you should avoid local water, ice, raw or uncooked food, raw fruits, and vegetables. Hepatitis B, C, and D contracted through contaminated blood can be prevented by not sharing drug needles, not sharing razors, not sharing used toothbrushes, not touching spilled blood. Hepatitis B and C can be contracted through sexual intercourse and intimate sexual contact. Practicing safe sex using condoms can help decrease the risk of infection. The use of vaccine is also an important key to prevention of hepatitis. Vaccinations are available for hepatitis A and B. Here are 2 more sources that you could go to for information. The Cutting Edge Testing Center in Van Nuys, located in Sherman Oaks. The number is 818-386-2132. This center offers testing for hepatitis A virus, hepatitis B surface antigen, hepatitis B core antibody, and a hepatitis C antibody. They also offer treatment options if your results indicate that you're positive for any of these. And then here's a website as well that you could go to for more information on hepatitis. And then here are my references, 2 CDC references and 5 articles. And then if you go back to the website here, just a preview of what's on the website, gives you information on hepatitis A, B, and hepatitis C. If you click on the subpoints, it tells you what is the hepatitis, if it's A, B, or C, gives you information on that. And then gives you more information on things you need to know, such as transmission, prevention, risk factors, symptoms, progression, vaccines to avoid, and more websites for more information. And that's about it. Thank you.